In equine medicine, portable x-ray units are often used. They're small and easy to handle, and you can kind of place them where needed. A caliper can be used to measure the horse. However, a lot of the units have pre-measured settings so that you can just plug in the view that you're going to do, and it'll kind of have it pre-measured to make it easier. Each machine does have the KVP settings or the MA settings that you can certainly alter. And it comes with a collimation light, so there's a handheld button that connects to the machine that you would just click. The collimer light comes on, and you would collimate in just as you would on a small animal to reduce any scatter that's unnecessary. So collimate in, and then you would hit the button even farther down to take the actual image. That image is often either shot on a cassette with film, or you can plug it up to your laptop and have a digital image, which is really handy in the field because you have instant results. Anyone assisting out in the field should certainly have their protective gear on, just as you would in a hospital setting. So that includes your lead apron, your thyroid collar, the dosimeter, especially your lead gloves, handling the cassette by the horse's legs. You're going to reduce radiation by having the gloves on. The patient should be properly restrained. Sedation isn't always necessary. It depends on the situation and the animal, but proper restraint at minimum to prevent any injury from the animal and to the personnel that are helping. Prior to any x-ray, the hoof of the horse's foot should be packed with clay. This reduces air from showing up on the image later, which can either cover up an injury or distort something that you're looking at. So just cover that so you don't need to worry about it later. It's also best to prop the horse's foot up on a block. That gives you a level surface from which to take the x-rays. So our large animal vet's x-ray unit has been sent off for repairs, so I'm going to try to demonstrate and simulate the main views that we would use when looking at equine radiology. Okay, so I'll move this down to the floor. You should be able to see. I use this as the block. Okay, so the views of the distal limb include the lateral, medial, DP, DMPLO, and DLPMO views, and all are done with the x-ray machine level and perpendicular to the leg. So this will be my x-ray machine, and this will be my cassette that we're using, and this is the block. So the first view, the lateral medial view, the image is shot from the lateral side towards the medial side. So the x-ray machine would be facing the leg, and the cassette would be on the medial side, shooting that way, going into the cassette. The medial lateral view is opposite, so the x-ray machine is on the inner side of the leg, in between the two legs, shooting into towards the laterally placed cassette, from which is on the outside of the leg. So that way, shooting that way, just so you can see all the views. The DP view, or the craniocaudal view, the x-ray machine would be head side, so facing the horse's leg, pointed towards the cassette, which is directly behind the leg. So on the block, behind the hoof, shooting that way. Boop. That way. For the DMPLO, the x-ray unit is on the dorsal medial side. This is the front of the leg, but it's rotated medially, so it's pointed towards the outside of the leg. So for this view, the machine is kept in front of the leg, like that, but the rear of the machine is angled in a way. It's going towards the center of the animal, or the center of the patient. So the plate, you keep it facing the animal, but you would move it in, getting us an oblique view, and your cassette moves with it so that it's always perpendicular. So you'd be shooting that way. And This highlights the dorsolateral and the medial palmar edges of the ball. In the DLPMO, the opposite is done. So you still have your X-ray machine in front, but you're going to be angling it to the outside of the animal. So the rear is moved to the outside of the animal, coming in this way. And your plate is lined up as well. So it's that way. And shooting in. And that would highlight the dorsal medial edge and the lateral palmar edge. You can also get different views by angling the image, and that would be by rotating the rear of the X-ray machine either in a 45-degree angle or a 65-degree angle, depending on which view you want. It's only those two settings, but that would highlight different parts of the bone structure, and it's usually used when X-raying the hoof. So depending on what you're looking at, you would angle the machine in those 2 degrees. And those are the main views when X-raying equine extremities.